But I want to start by saying British Columbians have been successful with COVID-19, in part because communities have worked hard together. We want to make sure that we keep people safe, and one of the best ways to do that is to have strong contact tracing. It's especially important, of course, when we have an outbreak. Contact tracing involves following up with people who have tested positive for COVID-19, making sure that we know all of the people they've come in contact with when they could have been infectious. Although we do support the federal government's work developing a COVID alert app for smartphones, the app can't tell you everything. Nothing replaces person-to-person contact. Public health teams typically have staff who work on contact tracing for communicable diseases. But during a pandemic, more resources are required. That is why I'm pleased to announce today that the province will be hiring 500 more healthcare professionals to increase contact tracing across British Columbia. Some of these positions will help support public health in communities, as well as, of course, preparing for the fall immunization plan, which we'll be announcing later this month. These positions will be temporary and will be recruited by the Provincial Health Services Authority. We expect many will be retired nurses and other healthcare professionals, as well as recent graduates. Our plan will allow health authorities to increase the number of public health workers focused on COVID-19. And it will also ensure that we have teams that we can deploy across the province as required. These positions will start in September, and this plan will help us deal with community transmission now and into the fall. And I'll ask Dr. Henry to say a few words on the content of today's announcement, and then I'll be happy to take questions on any other subject.
Thank you very much. So contact tracing and case management are terms that have really come to light for many people in BC only since this pandemic started. But as I have said a number of times, this is bread and butter work for public health. It's how we ensure that when somebody's infected with a communicable disease, something that can be transmitted between people, that we do everything we can to prevent that transmission and prevent others from getting sick. So this is something that we do quite commonly for stopping somebody from getting sick if they've been exposed. That the way that we control this virus in our communities is by making sure that anybody who's been exposed is in isolation and monitoring their symptoms and making sure they're staying away from others, so if and when they get sick, they're not passing it on. And the work of doing that is the work that we do in public health with our contact tracing teams. And across the province, each of the health authorities has developed teams that are experts in doing this. And so every time we have a positive case of COVID-19, they're followed up individually to find out exactly who they were with, where they went, the movements that we do every day, and we're very skilled at being able to go through those things with people in a very confidential way and making sure that we know those people who might be at risk. There's often different levels of risk, and we've put out alerts, for example, where people might have just been exposed for a very short period of time, and we ask them to monitor themselves carefully for symptoms and give them a number so they know what to do if they start to feel ill, and so they can get tested rapidly. For others, they may have had very close contact, and that's often people that we spend time with in indoor spaces, our family, our friends, maybe in a workplace where we've had settings or where we've had transmission. It may be in a healthcare setting. And for those people, we require them to stay home for 14 days. That's the incubation period, the period where they might become sick. And this is how we break those chains of transmission. And this has been the work that we've been doing since our first cases in January here in BC. And as the Premier has indicated, it's taken a lot of work. And many of the people who are doing this on a day-to-day basis across public health do other very important public health work as well. Everything from our immunization programs to restaurant inspections. And so this allows us now to get more people trained up to do this really important work as we continue through the progression of our pandemic here in BC and make sure we're prepared if there's a surge of cases in the coming months. And so the new people will be joining the teams that we have and will be supporting as surge capacity with our public health teams across the province. I will also note that the work that we do in trying to support people to make sure that they can isolate appropriately, that they have what they need to be able to stay home, to be able to stop these chains of transmission is incredibly important work, and we are committed to doing that to make sure that we bend our curve and keep it low here in BC, and we reduce the risks in our communities so that we can continue to increase our economic, to make sure that our surgeries are starting again. It's the key part that we need to do to keep going for the next few months to maybe even years until we have an effective vaccine for this virus. Finally, just to note that when we do ask people to self-isolate because they have been exposed, this is a public health order. So that means you are required to do that. And most people, when we give them the means to do that and we support them in doing it, have been very good about that. And we will continue to support people across the province as we go through our pandemic. Thank you.
Is the extra contact tracers today a reflection of needing more people, that we're falling behind in some way, or sort of update us on those figures?
Yeah, so I will actually be presenting some of that again tomorrow. But you're right. We looked at a couple of things: completeness of contact tracing and the time it takes to find people. So those are the two things we're focusing on. And that's why we put in some of the measures like requiring people to leave contact information if they're at a restaurant or going into a bar or a pub, so that we can find people more efficiently. And, this is one of the things where the CAN app may help us as well. But yes, we are keeping up, and as we've had actually a bit of a lull over the last few weeks, though as we know, increasing recently. We absolutely have been keeping up. This has been on the plans. We've been talking about how do we best prepare for a surge, also knowing that the respiratory season starts in the fall and that we need those essential parts of our community like schools to be going again. So it's all a matter of the balance that we've been talking about all along, of being able to open up our economy, getting people back to work, getting surgery started again, getting our healthcare system working, getting visits in long-term care home, getting schools started. And we need to make sure that we can continue to keep up on it. But right now, yes, we're working hard, but we're holding on.
Is this balancing out the app not being able to be used, or is the app going to come in conjunction with this increase in contact tracers? I guess that's more for Dr. Henry.
Yeah, well, let me start with it, Lisa, because it was at the federal provincial table where much of the discussion around a safe restart, what role technology would play, and how we could use the person-to-person contact, the gumshoe work, if I could put it that way, the detective work of connecting the dots so that we're protecting people. You can't replace that with technology. The technology is very helpful. We support that. There are some bugs in that tech right now, and the federal government is working with their partners to make sure that the application can be valuable to us, but it will not replace the personalized approach of talking to people and getting answers to questions that may not have been picked up on the app. And Bonnie, I'm sure you want to fill in the gaps there, but are you good with that?
Yeah, I'm good with that.
We're good with that. Hope that helps.